Good morning. I'm going to go over the Global Heart Network Foundation platform. Before I get into very detailed, this platform, it was originally designed by Dr. Kalango and team. This is purely for patient. Assume that like we have a child in the world who needs help. If they wanted to reach out to a physician anywhere in the world, this platform will be very useful. So this is a very centralized structure platform. It's originally designed by Dr. Kalango and team. When my team was involved, we brought the latest and greatest technology to implement this platform. Like I said, children suffering from congenital and acquired heart diseases in anywhere in the world. The children's parents or any caregiver can reach out to this platform. Hey, I need help. All they need to fill is their name and email. And one of our volunteers who is around the world in the mobile, they'll be able to get the message instantly, 24/7. And we are also introducing AI into this platform. So even when a human being is sleeping, the AI can take over. Then there will be an application sent to the patient caretaker, as well as any other information. The existing doctor report will be asked from the caretaker of the child, and they can easily upload. So when they upload this information, this conversation, where it is rest or interaction, it is very secure. Before we move forward, this platform, it is designed originally, the framework is designed by Wix. You'd have heard about it, where 45% of world website is being designed by this platform. This is a $7 billion company. So we use their platform to design this framework, and it has been hosted in 32 countries' data center around the world. And it has got all the compliances, HIPAA compliance, GDPR compliance, and the data is encrypted, and it is hack-free. In fact, I'll tell you a nice story. When we started launching this platform in Stanford, within 3 to 4 minutes, hackers are into this platform. All that will be prevented. So it has been hosted in 32 countries. Always the uptime is 99.999, close to 100%. So when an application is sent to the administrator, they will ask to upload the heart care records, investigation, imaging. We do have our own PAC server where we can store the image, which is a DICOM image of any mortality. We store it in the server and then send it to the physician in a very secure link. And that link will be valid only for certain hours or days. That is controllable. So once the patient information is available to the physician, then the expert will decide, based on the condition, whether it is operable or not. If it is operable, they'll be able to send it to the local team, which is part of our Global Heart Network, including funding. They'll take care of the patient, and then the surgery, then they'll do the post-surgery procedures, whatever is required. If the child is not operable, which is decided by the team of expertise, then they will send them to the local caretaker hospital for treatment. This is very, very simple. So this platform is multi-dimensional. When I say multi-dimensional, it is very patient-centric. All the patient has to ask is, in fact, I want to give a simple story. What happened is, yesterday I was testing the platform for today's demonstration. Dr. Kalango was laughing. I was telling, I need help for my child. So immediately our administrator from Turkey reaching out to me, Ramesh, some child needs care. is there anything we can help? Then I have to tell her, hey, this is a test we are doing. It was like midnight in their local time zone. So this is very, very powerful. And all the informations will be available in the mobile, in the desktop, and it is anywhere you can carry around. And not only one people, all the administrator can see the messages. Even if somebody is missing, others will be able to reach out to the patient who is in need. That's a concept. So this is originally designed by Dr. Kalango. I want to thank him for the opportunity. So like I said, this platform is multidimensional. So if you are a patient's family or a caretaker, what you need to do, I'll demonstrate to you in a few minutes. Then if you are a volunteer, like people like us, or if you are a medical professional who wants to volunteer, how you need to approach the platform. Then the third, if you are an NGO or an hospital, how you can help. Because some of our hospitals when we launched the platform in Stanford, the hospital reached out, hey, we have a $300K funding for 20 surgeries, we'll be able to help. So like that's the kind of response, very dynamic, you'll be able to get it from this platform. And another advantage is this platform is multilingual. Already it has been published in 7 languages, including English, French, Spanish, Hindi, Tamil, Kannada, and it can support up to 32 languages. Whichever language you need, it can be easily port over. And this online platform brings cardiac healthcare professionals, patients, volunteers, and organizations together to create impactful solutions for global cardiac care access challenges. That's the whole concept. Then, in terms of security, like I said, it is GDPR compliant, ISO 27001 compliant, PCI DSS compliance for payments also. We have about 82 payment gateways where a donor can contribute for any surgery. And these are all very secure. And we don't store any of the donor's information, especially their credit card or the bank account, we will not store. That's where the GDPR compliant is. And then the entire platform is encrypted. The communication between the patients to the system administrator in the local country, it is encrypted. And then it is DDoS protection and backups and recovery. All our website information is continuously backed up by the global leader, which is a Wix platform. And then the access control, it is multi-factor authentication, which you know. So it will have a password. And once you key in the password to the website, it will send out OTP to your mobile platform. So it is industry compliance. And then it has been monitored 24/7. And the vulnerability patching, it is constantly happened by Wix. So we don't need to worry about the integrity of the platform. And then people who are all using the platforms, their information is very well secure. So this platform will do a global impact by connecting cardiac healthcare professionals, patients, and volunteers to tackle and cure pressing cardiac healthcare challenges. And we do have an advanced EMR system, which is again developed in an open source. 24,000 plus developers are contributing to this platform. And Sean and team come up with a template, I call it in technical, where to capture the information for about a patient in CST, and these are all easily customizable by each and every doctor. And again, it does have a HIPAA compliant, encrypted, secure telemedicine portal as well. So when a doctor in somewhere else want to help a patient, we can use telemedicine. And then it does have a digital image sharing, like I explained. And then it has got a very integrated patient care system. Even post-surgery, If you want to monitor, like, we are integrating with Tesla, which is a care nation. Post-care care can be automated in this platform. So the main goal about this platform is it empowered the community, increase the volunteer opportunities, and then continuously engaging the professionals. And then it does have a real-time chat support. Like I said, instant communication, 24/7 availability, and it does make the collaboration very easy, and it does have a clear volunteer engagement. You can join as a volunteer. We do have a detailed volunteer database, and we can track your impact, and then it does provide opportunities for all. Whether you are a medical professional or administrative expert, or simply you wanted to help, there is a role for you in this platform. And even for medical professional registration, it is very, very effortless sign up. All you need to do it is, you click the button where you are a medical professional, sign up, you give your email ID, and then one of our administrator will contact you to provide your, to get your credentials. Then they seamlessly onboard you to our platform, and then you can join our professional networking. Now, let's say you have a group of physicians. You wanted to share your knowledge. You wanted to train the young professional. There is a way. You can sign in into a membership portal. We create a separate portal for you within few minutes by click of a button. So in that, you can have your own group. You can add, for example, I'm part of a Greece group and then North America group in terms of technology. Dr. Shan is part of the North America. Dr. Kalango is part of the Greece group. You can join, and then you can share the content between groups. You can train professionals, which is online programs, and then you can take the programs whenever you have time. You don't need to be online all the time. So you can do it, and then you can use this platform in your mobile as well. It's on the go. Now, in terms of EMR, it is a very comprehensive EMR system. It does have an integrated workflow, which can be heavily customized, like I said. And you can get real-time updates, and the data is very secure. It does have a telemedicine, and we have our own PAC server. All these are very proven, and it is being used in the commercial hospital as well. And in fact, like, we are in the process of implementing in a hospital in Hyderabad, India, which is a 200-bed hospital, and our own Sai Arogya Swami's hospital, where it's a 50-bed hospital, and every day we treat around 120 to 150 patients for the last 6 to 8 months. And it's been very successful, and it has got its own PAC server. We can support up to 9 modality, where we can share the information. Now, we can even have our own event. Let's say you are part of a group. You can create your own events in the local as well as in global, and you can do a telecast, and then you can update all the event content, any photos, galleries, all that can be done. And then project collaboration and funding, which is very, very important. When you bring a few physicians to help a child or help a group of children, funding is very, very important, where project management tools, where you organize and track initiatives within the Global Heart Network system, and this is very, very transparent. You know where the funding is being used for, on which project. If you are a donor, we can easily provide those information. And then you can also, as a donor, you can see where are all the funding opportunities. And this is a very open innovation platform. You can even have an idea incubator, like I said. You can create your own post. And some of the physicians may like, dislike, they can argue. All that blog concept, we brought it into the platform as well. So now let me show a few of the website itself for us to understand better. So like I said, this is our Global Heart Network platform. We call it. It's more than a website. So if I wanted to translate into Spanish, all I need to do is click off a button. The entire website content will be transferred into Spanish. It's that easy. So let's say I am a father of a patient. All I need to create is click a patient button. It says connect with Global Heart Network. All I need to fill it in my information, and then subject, I need help. And I say I'm a patient family, and any text messages I say test so that she doesn't understand, and then all I need to send. That's all the information they have to send. I'll show you how this information is being captured in our platform. So assume that I am admin. A patient is being sent a simple request, I need help. It's immediately captured in our, so you see all the information, my contact information, even if I give a number, immediate it will be. And the same information will be available in the mobile also. I'm getting a notification right now, which has been saying it's already there. I'm going to share this in, so this is a mobile version of the app where you can see, so you can see all the home. So these are all the contact information I have. And it does have a analytics. How many people are visiting the site? All this information, you have it in your workflow, and then you can even see in which part of the country people are accessing our platform. Right now, if you look, I'm seeing there are 2 visitors are in the platform, one from India, another one from Ukraine, and what exactly the visitor is trying to explain, and then from here you can chat to the visitor also. So this is very interactive, and we do have analytics, the site session, unique visitors, how many people are clicking, what is the traffic overview about the platform, all those information we can see, and we do have a AI chat. The AI chat, beauty of it is, it constantly learn about our platform. So let's say a group of 10 doctors, they constantly do a post. It learns, and some of them ask anything specific about that specific post, it will be able to answer. And then the visitor, like all my, this is not the email, this is the inbox, which all the messages are secure. It can be accessed and then filtered by our admin by country. So for example, if you want a super admin who can see all the messages, or if you are admin specific to Greece, you can see only those patients' information. It is very secure. We can do that as well. And then if you want to do promote some of the training program, we can do that also. So people can buy the training program, and then which can generate some dollar to our Global Heart Network. That's what Kalango and I are working with Dr. Sean, and we do have a blog, and we do have a group. All those are available in a very simple, light-weighted, mobile base. It's available worldwide, and it is hosted in 32 countries. So I explained about the patient. Now let's say you are a volunteer or an NGO. Same thing, you have to submit a form, and then in the WIX admin console, you'll be able to see, you see here, it's clearly displayed. It is a patient, and this is a volunteer. So you'll be able to like clearly identify what is a volunteer is going to offer for our Global Heart Network. All they need to do it is filling the basic information. Now, if you are a doctor or a medical professional, we take it to a complete into our EMR platform. If you are a medical professional, this is very secure. It is a HIPAA compliance. So where you have to clearly mention, so I'm going to like demo, I'm a doctor, I'm going to fill in my information, and then all you need to do, submit, and then it registers you. So one of them, here it's saying I already registered. It's saying there is a duplicate. If you are already registered, all you need to do it is you have to log in back to the platform. Yeah. So when you, as a doctor professional, assume that you are already registered. All you need to do is log in. You have two options. You can have your user ID and password, which our admin will securely send it to you, or you can log in with email link. You don't need to remember the password. It will send you the link to log in. Once you log in, you are into our EMR system. And this is not only the EMR, you can completely automate the hospital. If you are having a clinic, we provide this software for free. If you are part of our Global Heart Network, you can do patient registry. You can give a separate portal for your patient, which is My Chart in US, where the patient can see their medical records. All that we can offer under Global Heart Network. Now, even if you want to run your own clinic in terms of accounting, you can use this software as well. So I'm going to show the PCST template, which has been designed by Dr. Sean and group. So you can get the basic details about the patient. And this is not, if you are not a type savvy, you can do the enable voice recording too. And it can be in multilingual languages. It will be able to record it very accurately in the platform. And you can have the diagnostic details, birth information, hospitalization, and then surgery details. All these records are maintained in one area globally in our GHN platform. Any questions, please? Please.
Good morning. Yes, first of all, I would like to congratulate you on this great innovation. Really, I believe this platform should be presented to all humanitarian organizations because, you know, people, when they will realize that it's very helpful, I believe they will affiliate themselves more. A question, if I had the impression that we can upload the mobile phone for our smartphones. Is it possible as well to have the application?
Say it again.
The application, is it possible, you know, to upload the application to the smartphones?
Yes.
Yes. This one is. I was not aware of that. Is very good, this one, because we can ask, you know, all these people who would like to be affiliated to the program to download, you know, the application on their smartphones.
We can help, yeah.
Yes. And then, you know, now what I was discussing with Dr. Siti, it was how to promote, you know, this one. For promotion, let me propose, you know, first to start with our humanitarian institutions. And I have the impression that the center in Fiji is because there is no, on a daily basis, a surgical activity. It will not impose an additional work to the system or to those people who are supposed, you know, to pass all this patients' information to the system. Before each mission, we have, you know, to discuss, or you have to get in touch with Dr. Krupali. And first, you know, we have to impose also Swami, telling, you know, first, internally, in our humanitarian institutions, you know, all the patients for whom, you know, we are here to provide services should be registered. First, you know, let us start, you know, with internal work.
Okay.
And because we have to be credible, and to be credible, it means how, you know, to attract the other institutions is by showing that there is a lot of patients already registered in the system, recorded in the system. This one is important. Perhaps, you know, next week we can try, I don't know if Dr. Krupali is back to Fiji. She is. You know, try to explain and try, to convince her to start, for the next mission, to put all the patients, to make her registration to the system. The same with Dr. Ragini.
Yeah, I have good news.
Yeah.
Our EMR is already running in our Fiji hospital.
Yes.
So to put our global heart network on top of it, it is very straightforward. Yeah. And the new cath lab which is coming in Fiji,
yes.
In fact, our technical team is working closely with Fiji team
yes.
to implement it. So we'll start the conversation with your presence as early as possible.
Okay,
yes.
Very good. And then, I saw, because I proposed Dr. Linik from Belarus, because I'm promoting also the program in Minsk with Drozhonsky. He's the chief pediatric surgeon. And they would like also to offer some free of charge pediatric cases, because the system in Belarus allows, this kind of surgical treatments. And I realized that he has already made his registration. Perhaps, the second center could be, Belarus. Because, he was very faithful, he understood. And then we have the chance to get, the Ukrainian team. They are doing, great job. Especially the center is run by Professor Todorov, who came personally. And I would like to ask, if you would like to be affiliated, because it's an overvalue also for your center, for your institution. Yeah. Perhaps, you can exchange,
sure,
your contact details, and then, probably he will tell us, who will be responsible in his institution and do, the registration.
Sure.
Because especially after the war, there will be a lot of patients that we can send, to Ukraine. For example, Moldova. Moldova is a poor country. They don't have, very good pediatric heart surgery, and Ukraine can have, even, in children they do pediatric heart transplants. They have a huge program. And it's a way also to promote these local institutions, to put them in a leading humanitarian position, because they are doing, even in very difficult conditions, they are doing, a great job. They will present now, you will see Dr. Sethi.
Yeah.
And then, what I can do, I can get in touch, it was the initial idea, to get in touch, with my old humanitarian project institutions we set up. For example, Mauritius. In Mauritius, we initiated the cardiac center, which is a regional center covering the majority of the needs in the Indian Ocean. There is a lot of children. We refer from Comoro Islands, Seychelles Islands, Madagascar. There is no pediatric heart surgery in Madagascar. Cardiac center can be affiliated. My institution automatically is affiliated. And then, we have a center in Kyrgyzstan. There is a center in Serbia, Belgrade, which could be affiliated. I saw, there is a team from Turkey, Istanbul. They have already made the registration. I believe, we have to be more actively involved to promote, but let us start with our humanitarian institutions, and then go to the France, and then, try to expand quickly.
I'm very happy to see you growing up this project, and my congratulations and gratitude for your amazing job. But I have a question about follow-up of the patients. Like what yesterday we saw with Guj, which then they are lost. Is it possible to do follow-up as well, like lifetime follow-up and remind patients about checking in up, as well as send?
Yes, that is what I meant by patient portal. Meaning, let's say I have my loved one who got treated by Dr. Kalango. Our platform will give a separate portal for my child,
yes,
where we can do the current history as well as any future appointment follow-up. Yes, you can easily do that in the platform.
That's wonderful.
It's a full-blown EMR system and complete automation of bigger hospitals also.
Hello.
Please.
First of all, amazing, congratulations, really very, very good work. I'm very happy that it's also in Spanish, the possibility, because
Yes.
yes, Swami has given the instructions to open the cardiosurgery hospital in Buenos Aires in Argentina. It will be a referral center for Latin American countries. Then, as in Latin America, we are speaking Spanish-speaking countries, that will help a lot. A few questions. Are there ICD-11 or ICD-10, WHO ICD codes included in the medical record?
Yes.
Perfect, thank you.
And you can even do SNOMED also, which is European standard. All the code which can be customized based on your specific specialty.
Good, very good. Other point, sorry, I enter into the session a few minutes later. Suppose that we are using this software or this project in our country, that should be registered to our health ministry,
Yeah.
because that's possibly how do you manage it? You understand my question?
Yes, it is. We can. This can be. It's compatible globally. We'll be more than happy to work with you.
Fantastic, fantastic. And the other point is only for referral. You are mentioning that it would be for the hospital during all the staying of the patient at the hospital.
Ask you.
No.
Yes.
Yes. And day by day, you could enter the information of the patients.
That's what I was trying to explain. The one
Oh,
hospital.
sorry, I entered later because I missed
No
that.
problem.
Yes.
The one hospital where we are live, it is Swami Sai Arogya Hospital.
Yes.
Which is completely free, where we get 120 to 150 patients, both outpatient as well as inpatient. We do have a lab, prescription, everything is automated in this platform. We'll be more than happy to give you also.
Really, it will be very, very, very useful, and we don't need to produce our own software. Thank you so much.
Congratulations, it's an amazing platform. I just want to clarify, so if I put information on the app regarding a patient, and that patient happens to be a patient at, say, the Fiji hospital, will that information electronically be transferred to the electronic records at the hospital or not? So I'm just trying to join the two so that if the physician is in the hospital, he knows what has taken place within the app, what has the information.
So it's a centralized repository, which means the application is hosted in the cloud. So whether you are a doctor access from India or from Argentina or from US, you can access the specific patient record who is in Fiji. Let's say you are doing a consultation. So it will be stored with the patient, which can be maintained in the cloud.
Right. So it's stored with the patient.
Correct.
But not stored in the hospital?
Every hospital will have a separate instant. For example, let's say Argentina Hospital A, Fiji Hospital B.
Yes.
It will be stored in that specific hospital. But you, as a physician, you can if you have access to both hospitals, you can see the patient data.
Right. Wonderful.
Yeah.
It's extraordinary. Thank you.
And then, as you know, now Fotini is the administrator. And I was laughing, I was very happy because she reacted immediately. It means that, she's doing great work, and she's she keeps herself very vigilant regarding, this platform. The second step, first, we have to start with registrations internally. And then the second step is Kalangos Foundation is a Swiss-based foundation. And we are also a member of the World Heart Foundation, which is also based in Geneva. I will get in touch with them because they have, a lot of email addresses, a lot of health professionals in cardiac care, involved in cardiac care. to be part of the promotion of this platform. It will be the second step. Again, the second step, as you know, there is in Geneva the United Nations local office. I will try to contact them, or personally, I will ask for an appointment. Perhaps, we can organize a Zoom meeting, or, send to all the ambassadors in Geneva of different countries, especially, we can start with the low and middle income countries, contacting them, presenting the program, and asking, the ambassadors, the diplomatic missions, to get in touch with their health authorities, and to make them aware of this program.
Sure.
Okay, this one will be the second step, I believe.
And
Because the third step, then, what I imagine, it will be, as I mentioned, during my opening address, is, the creation of a International Institute of Humanitarian Medicine. I have already started the creation of the European Institute of Humanitarian Medicine. I had, some contacts with Cyprus, because we have, to make this project pass through the parliament of one of the European countries. And the easiest way is, Cyprus, because it's a small country. When, the project will be accepted by the parliament of one European countries, it becomes a European project, and then we have to get an office. I will later discuss with Swami. We have to get an office either in Strasbourg, where is the European Parliament, or in Brussels, which is the capital of European Union. And then, we can get a lot of fundraising for them. There is, two important sources, because we have also to financially promote, this platform, because we have, to promote financial help to these children, to these families who will apply, for their children, for the surgical treatment of their children. This one will be the third step. Then, we have to be visionary and go, to the creation. Perhaps before an international organization is better to start with a European. And European Academy of Humanitarian Medicine will be supposed for the training issues. Will be supposed, to take over the training issues and give, certificates. For example, in Istanbul, in the center, there will be, a lot of local teams who will come, to be trained, and I believe, we have also to give them a certificate of training.
One more question. There is different law in different country, I think, about data protection and how to manage this project. Or it should be lawyer permanently engaged, like with international law to...
Yeah, each country is supposed, to make, is a good question, because different countries, they have, different ethics, different rules regarding the confidentiality of the agreement. Here only physicians, they have, access to the critical, crucial, patient-specific information. Is protected, the system is protected. Yes, but each country, have to make the registration to the health authorities of the country. At least, they have to be informed, and they have, to register this platform as a platform of public utility.
Sure.
Yes, they have to recognize.
So on a very high level, yes, it can be easily done to comply with the local laws of a country. In fact, India and US are very particular. The patient information, PHI, will not go abroad. So this platform is designed to accommodate those laws. So if it works for US, India, and Europe, it should work in the other part of the world as well.
Yes.
And about foreigner patients, if he is like, let's say, not Ukrainian, operated in Ukraine, and his data not accessible to the physician from his country?
So it can be accessible only with patient consent. If the patient is a minor, the patient's parents or guardian will give a consent. So it follows a law, medical law.
Yes.
Did I answer your question?
Yes.
They cannot just access.
No, because there is the family consent form. This one is crucial. Yeah, this one. And even, family can give also the consent to the medical group or to the administration of the, later on we have to check also with lawyers, to the administration of the Global Heart Network, to share some information between, within the medical group, because there will be a committee which will be supposed, to screen these patients, because everybody applying, will not be operable.
Agree.
And then, we will not pay money, to bring children for nothing. And then, as you mentioned, the local facilities, they have, to take over the medical care if there is no surgical treatment option. It means this one also should be clarified.
Yes.
Yeah.
And
No, there will be a local, the local. For example, you can be, Dr. Sethi will be, and we will some pediatric cardiologists, and we are supposed, to check the medical files sent by the family, because in this platform you have the possibility to download all the medical files necessary, to make an opinion or a medical opinion, and if there is indication for surgery or medical treatment.
so the way how we design, we call it as a workflow, which can be customizable as per country requirement, and access can be restricted or granted as per the country law.
Yes,
It is possible.
it's
already-
modulable.
Yeah,
Yes, this one is good.
correct.
Yes.
Sorry, you have done a lot of work, first of all. Suppose that we want to offer to some organization and they say, okay, sir, but I want to know if you will be here 10 years in advance, because all of us know that in this field there are a lot of movement and some people are here today and in 2 years there are not. How do you manage that situation?
So,
Sorry
I
for the question,
I
but-
want to explain this, like the journey. This entire platform is owned by our Swami, technically. Like not one individual has owners to it. Now, this specific GHN platform, it's originally designed by Dr. Kalango. So this platform will be dedicated to GHN Foundation. So right now there are two partners. One is our Swami's Institute and Kalango's Foundation. They own it. We are just volunteers.
Yes, all the projects, as I told you, the
And-
common project will belong to you also, because,
And we
Yes.
have a dedicated team.
yeah,
And all this are built on a open source platform where we have 24,000 developers outside where we can hire.
yeah.
Not only our team. So that's how we
Yeah.
kept it in mind. It's
And-
not going to be tied up to one individual at all.
Yes.
It's by our institute.
And even, the European Institute or Academy, the European Academy or Institute for Humanitarian Medicine, or the international version will be affiliated. This one is, we have to act together. This one is important. Yes, and as you know, we decided to organize since now, all this global humanitarian forums here in Modena Khale, because we have also to reinforce, to give, more visibility to the globalized humanitarian mission of Swami. We have, as individuals, help his projects. This one should be clear. And for a reason, I didn't agree with Annabelle, because there was, some other intentions, and this one, no. We are working all together, to promote the globalized humanitarian mission of Swami. This one is the clear message. And then there's another remark, because I forgot. You know, we have also to affiliate the Humanitarian Journal of Cardiovascular, or the Journal of Humanitarian Cardiovascular Medicine, because everything, you know, we discuss should be also reflected, you know, to this journal. And in order to give, you know, visibility, and through the journal, perhaps, you know, create also a huge network of communication, exchange of ideas, opinions, and so on. Is it possible, you know, to affiliate the journal?
Yes.
Yes. Okay, I will tell, you know, I'm going back Monday, you know, I will tell Fotini to clean up first, you know, with the tax authorities, you know, this small issue, and then, you know, the affiliation of the journal to the platform.
Yeah. And we have complete videos on each and every topic, and I'll share with the group. Since we have a very limited time, I couldn't demonstrate all the details, and we can even have a private training session as well. Thank you so much.
Yes, thank you so much.
That was a fantastic demonstration and discussion on the Global Heart Network. I think, you know, the thought process behind this is that we talk about humanitarian organizations being involved with this, but hopefully one day private institutions will be involved with this also. There could be a hospital in a city that would say, you know, we're happy to do 2 free surgeries, or we're happy to do 2 free caths. And I think the more hospitals globally we can get joining in on that, makes it so much easier for the patient to go get care close to where they are. So that's a thought process. And I will tell you, it was like being a kid in a candy store working with Ramesh and his whole team. Didn't matter what we asked, he got it done, and I really did not believe that a lot of these things were possible, and he did more than we asked. Some of these things we didn't even ask for, so, you know, really from the bottom of our heart, it's taken so much work for your team to do this, and you've gone through every single step, and honestly, people have been trying to do this for years and haven't been able to, but you did it. So I just want to give our appreciation for that.